What are analgesics? Analgesics, also known as painkillers, are drugs used to relieve pain without losing consciousness. They are classified into the following categories: non-opioid analgesics, opioid analgesics, and adjuvant analgesics. Non-opioid analgesics include drugs such as nonsteroidal anti-inflammatory drugs, or NSAIDs, acetaminophen, and dipyrone. Opioid analgesics or narcotic analgesics include drugs such as morphine, codeine, tramadol, and tapentadol. Adjuvant analgesics include drugs such as GABA agonists, neuroleptics, muscle relaxants, and anticholinergics. Depending on the mechanism of action and usage, analgesics can be further divided into the following subcategories: nonsteroidal anti-inflammatory drugs, COX-2 inhibitors, opioid analgesics, cgrp inhibitors, miscellaneous analgesics, and adjuvant analgesics. What are nonsteroidal anti-inflammatory drugs? NSAIDs are a group of drugs used to relieve pain, reduce inflammation, and fever by targeting the two cyclooxygenases enzymes, COX-1 and COX-2, responsible for the production of prostaglandins from the fatty acid arachidonic acid in the body. Prostaglandins are lipid compounds that have hormone-like effects and are found in all tissues of our human body. They are produced by the walls of the blood vessels and involved in the regulation of smooth muscle contraction and relaxation, including those of the blood vessels, uterus, gastrointestinal tract, and urinary bladder. For example, prostaglandins are responsible for the vasoconstriction and vasodilatation of blood vessels. Prostaglandins are also involved in inflammation through their role as pro-inflammatory mediators during the acute phase of inflammation. Additionally, prostaglandins induce fever through their action on the thermoregulatory center in the hypothalamus. Another function is associated with their role in platelets aggregation during coagulation, and therefore, are also involved in the formation of blood clots in the blood vessels. Therefore, NSAIDs, by inhibiting the enzymes COX-1 and COX-2, prevent the production of prostaglandins, resulting in pain relief, reduction of inflammation and fever, and prevention of thrombosis. The most known NSAIDs are aspirin, or acetylsalicylic acid, ibuprofen, also known as Advil, Nurofen, Motrin, and naproxen, known as Aleve, naproxen. NSAIDs are used for the relief of mild to moderate pain in conditions and disorders such as headaches, migraines, toothache, menstruation, muscle strains and sprains, rheumatoid arthritis, and osteoarthritis. What are COX-2 inhibitors? COX-2 inhibitors are also NSAIDs used to relieve pain, reduce inflammation, and fever. However, these drugs selectively target COX-2, while the other NSAIDs target both COX-1 and COX-2. The advantage of the COX-2 inhibitors is their reduced side effects on the gastrointestinal tract when compared with the other NSAIDs. However, some concerns were raised about the safety of some COX-2 drugs. COX-2 inhibitors include drugs such as celecoxib, known as Celebrex, and rofecoxib, known as Vioxx, which were withdrawn from the market. COX-2 inhibitors are used for the relief of mild to moderate pain in conditions and disorders such as menstruation, hereditary polyps of the colon, ankylosing spondylitis, rheumatoid arthritis, and osteoarthritis. What are opioid analgesics? Opioid analgesics or narcotic analgesics are used for the relief of moderate to severe acute or chronic pain. This class of analgesics includes drugs such as morphine, codeine, tramadol, and tapentadol. These drugs relieve pain through their binding to the opioid receptors, example Mu receptors, found in the brain, spinal cord, peripheral nerves, and gastrointestinal tract. The increased prescriptions of opioid analgesics resulted in less effective therapy and substance abuse. Opioid analgesics are used for the relief of mild to moderate pain associated with cancer, and for palliative care or end-of-life care. However, due to their oversubscription, they have been used for the relief of all types of pain. What are cgrp inhibitors? cgrp inhibitors are drugs that relieve pain by targeting a peptide known as calcitonin gene-related peptide, or cgrp. cGRP is stored in neurons of the brain, spinal cord, and peripheral nervous system, where it is involved in the transmission of pain. cGRP inhibitors include monoclonal antibodies that bind specifically to cGRP and block its action, including eftanezumab, or Vyepti, galcanezumab, or Emgality, and fremonezumab, or Ajovy, and monoclonal antibodies that bind to the cGRP receptor such as irenyumab or Aimovig. cgrp inhibitors are used to treat patients with frequent, episodic, or chronic migraine headaches. What are miscellaneous analgesics? Miscellaneous analgesics are a separate class of analgesics as they belong to neither nonsteroidal anti-inflammatory drugs nor opioid analgesics. They include analgesics such as acetaminophen, known as paracetamol, Tylenol, ziconotide, and dipyrone. However, in the United States, only acetaminophen and ziconotide are available. Acetaminophen is used for reducing fever and relieving mild to moderate pain associated with conditions and disorders such as headaches, migraines, toothache, muscle strains and sprains, rheumatoid arthritis, and osteoarthritis. Ziconotide relieves severe pain by blocking N-type voltage-gated calcium channels found in thedendrotesin nerve terminals and is involved in neurotransmission and in pain transmission. Dipyrone, or metamizole, is used as a painkiller, spasm reliever, and anti-inflammatory agent for the relief of acute and chronic forms of pain, high fever, acute injury, colic, and cancer pain. However, metamizole is banned in many countries including the United States. What are adjuvant analgesics? Adjuvant analgesics are drugs that are not considered analgesics but are used for neuropathic pain, musculoskeletal pain, or cancer pain. This group of drugs includes antidepressants, alpha-2 adrenergic agonists, corticosteroids, neuroleptics, muscle relaxants, and anticholinergics. In conclusion, analgesics are used for pain relief and for the reduction of inflammation and fever. They are differently used depending on the severity of the pain. However, their oversubscription or misuse can result in disorders affecting the gastrointestinal tract, example NSAIDs, or drug abuse, example opioid analgesics. If you enjoyed the video, please like, subscribe, and share for more videos like this.